Hello, I'm Dr. Malcolm Barfield. Today we're going to be discussing how to achieve pregnancy. We're going to discuss use of time intercourse and ovulation prediction to increase sperm exposure during the 2 or 3 days of the month that you're able to achieve pregnancy. Always be sure to start prenatal vitamins 1 to 2 months prior to becoming pregnant. Also, if you have any medical conditions, please come in and see us and be evaluated prior to achieving pregnancy. We need to make sure that you're taking medicines appropriately and not taking any medicines that you should not take while being pregnant. To help me explain this, I'm going to draw a diagram. So we'll go and see the diagram. Okay, so now we're going to go through timed intercourse. This is to help you achieve pregnancy quicker by increasing sperm exposure to the egg. Typically, you can get pregnant within about 72 hours of ovulation. So, paramount is to know when you ovulate. You can use an ovulation predictor kit for this. If you have regular cycles, this will be very predictive. There are several different ovulation predictor kits that you can get in any of the pharmacies. They range anywhere from $20 all the way up to a $200 Clear Blue Easy. Typically, you get what you pay for, and the $200 Clear Blue Easy is a much better choice. But again, purchase what you can afford. All of them should work. Again, this is considering the normal person with no medical problems, such as polycystic ovarian syndrome or any other ovulatory dysfunction. One side note is if you use a lubricant, you should not use it while you're trying to achieve pregnancy. If you must use a lubricant, you can order pre-seed off the internet, but most lubricants like Astroglide and KY Jelly will prevent you from achieving pregnancy. It'll stop the little spermies in their tracks, and it's not pH balanced correctly, so it causes a lot of problems with the sperm. Now, the diagram that I have here is a typical 28-day cycle, and you count backwards from day 28 to get your rough estimate of day of ovulation of day 14. If you had a 30-day cycle, you would count backwards from 38, and you would get day 16, so on and so forth. If you have a 34-day cycle and it's regular every month, you're going to ovulate around day 20 of your cycle. Now, if you do have a 28-day cycle and you're ovulate on day 20, that's something you need to discuss with us and make an appointment so we can evaluate you further. But again, this is for someone who has a normal 28-day cycle, and day 1 is the first day of real bleeding. Day 28, if you spot a little bit, would be day 28, and again, day 1 would be the first day of real bleeding. We're going to assume that you have roughly a regular cycle around 7 days. Some people have more or less. Doesn't really matter for this timed intercourse demonstration. Most people, again, can get pregnant within about 72 hours of ovulation. So we're going to assume that day 14 is your day of ovulation for this demonstration. Just a little bit easier for me to do the math. Prior to day 13, we're going to have no sex for 5 days. And the reason is it increases the sperm count. Oddly enough, if you have sex pretty much every day, you have a decreased chance of actually achieving pregnancy because you're going to have a functional decrease in the sperm volume, or sperm count, I should say. So actually waiting for 5 days will increase the sperm count. Again, what we're trying to do is increase sperm exposure. You typically can get pregnant within this time frame, so we want the sperm delivered to the egg here in the largest volume or quantities. So after the 5 days, around the time of ovulation, roughly the day before you ovulate, we'll have you start having intercourse every other day. So day 13, day 15, and day 17, you'll have intercourse. And during that time, you should be able to increase sperm exposure. Now, after this time period, you can have intercourse all you want. Not going to really help or hurt. A couple other things you can do for this timed intercourse to increase sperm exposure, as I've listed down here. Number one is the Diva cup. It's a little plastic cup for people who cannot tolerate tampons or pads. It's roughly $17. You can order it off the internet at Diva Cup by Googling Diva Cup, or a lot of health food stores or naturalist stores may have them. You can use it to catch your menstruation instead of use of a tampon if you'd like, but that's not what we're going to use it for here. What I want you to do is, as soon as the penis comes out, typically about 10% of the sperm will come out with the penis, but I want you to insert the Diva Cup. Now, we used to have you stand on your head for 2 hours, which is totally impractical. I mean, right after intercourse, you have to go pee-pee, you want to run to the bathroom. By the time you go to the bathroom, the penis comes out, brings out 10% with it. You go to the little girl's room, you pee, probably another 60 or 70% comes out with it. You've lost all but about 20% of your sperm within the first 5 minutes. Well, the problem with that is sperm does not become motile until it completely liquefies. What that means is the mucus that it's in dissolves and allows the sperm to move. Now, that can take from anywhere from 20 to 30 minutes. So inserting the Diva Cup will keep 80% of the sperm instead of losing 80% of the sperm in the vagina. Just insert it and leave it there for about 4 hours. Now, for the man, you can actually give him caffeine. Take caffeine 30 minutes to an hour prior to intercourse will actually increase sperm motility once it becomes liquefied. Both of you can actually use Robitussin. Robitussin will thin out your cervical mucus, allowing the sperm to move more freely up the cervix into the wound, and it'll also make the sperm liquefy quicker and more completely. So this is a few things, again, to recap. No sex prior, 5 days prior to the day before ovulation. So then the day before ovulation, the day after, and then 2 days later, you'll have sex using the Diva Cup, caffeine, and Robitussin to increase sperm exposure during this time close to ovulation. Again, you should be taking prenatal vitamins several months prior to trying to achieve pregnancy. As soon as you become pregnant, you need to let us know about it. If you have any questions or problems, please write them down. We'll be more than happy to see you in our office at a preconceptual counseling appointment. If you have any issues with fertility or ovulation prediction, or your cycles are irregular, then you need to get an appointment. We'll evaluate you further. Again, if you have any questions, please let me know. Otherwise, we'll see you when you're pregnant.